Hi, today we're going to talk about starting an IV. So before we get started, you want to make sure that you review your healthcare provider's orders to make sure you know what kind of fluid that needs to be run if we're going to start fluids and what we're using the IV for. Remember that our patients' IVs are our lifeline for them. It is how we give nutrition, medication, fluids, and so it's really important to master this skill as you move along. Before we get that, and after we've looked at our physician's orders, we want to gather our supplies. So to start an IV, you're going to need your IV catheter. And knowing what the patient is getting will help you determine what size catheter you want. I usually start with at least a 20 gauge catheter. That's a pretty safe size to give medications and fluid. We can even give blood with a 20 gauge catheter. 18 gauge is sometimes preferred, but a 20 gauge will be a good starting point. You'll need your IV start kit, and we're going to go over what's in that in just a moment. You'll need a flush syringe with your normal saline, and either an extension set or your IV tubing if the patient's going into the pre-op setting and we're going to connect directly to IV fluids. So we can go ahead and we want to first perform our hand hygiene and make sure that we get our hands nice and clean. And when you get your supplies together, you really don't need to wear gloves here because this is just getting everything ready. So in our IV start kit, you're going to have some tape. And I like to tear off 3 pieces that I will need, and I get them ready close, and I usually use the patient's bed rail or the side table, something that makes it nice and convenient for me. You'll have your tourniquet, and I like to go ahead and put that on now while the veins are popping up while I'm getting my supplies ready. Be sure to put the tourniquet 4 to 6 inches above your proposed site, and a lot of times I kind of put it up higher on the forearm so I have a look at what's going on. We also have our skin cleanser, and then our Tegaderm, and a 2x2 in our kit. We also need to get our extension tubing if we're using that, and we want to flush it with our saline syringe. Remember, you want to keep your edges sterile, so you want to not touch the tip of either one, and then go ahead and flush this. Always make sure you check this connection here. Oftentimes in the package, it's a little bit loose like this one was today. So you want to make sure you tighten it so we don't have any problems. I also like to kind of loosen the cover here. So after I've started the IV, it's a little easier for me to get to. And I place it right next to my patient. Okay, so now we're ready, and you can see I've got a nice vein that's popping up on the forearm. As we choose our sites and you begin sticking, remember we want to start more distal than proximal to our patient here, because if we do miss the IV or infiltrate, we're going to need to go higher. So you don't want to start way high because then we're kind of stuck. In the perioperative setting, or excuse me, the preoperative setting, oftentimes we may start with the hand or sometime in the ER as well, when we're looking at more short-term IV usage. But during this phase of the patients in the hospital, I like to use the forearm area and not the hands or the antecubital, because that allows the patient to use their arm and their hands really well. Okay, so first thing we're going to do is activate our cleanser. So this is a chlorhexidine prep sponge. And inside we have our cleanser, and you need to squeeze the handles and then put the tip down and give it a couple squeezes, and that brings the cleanser to the surface. Now, if you have alcohol-based cleanser in your IV start kit, we're going to use those a little differently. For chlorhexidine, we can just scrub the patient and just go in back-forward motions over the site. And I like to prepare a big site, so usually we start horizontally and then we can go vertically. Now, if this were an alcohol-based gel, the way you want to use that is we want to start in the center where our proposed stick site is, and then we're going to come out in concentric circles in a large area. And I usually like to cover the area where the Tegaderm is going to sit. So depending on what your cleanser is how you're going to clean the patient. Next, we're going to take our IV catheter, and you want to be sure to keep this clean and non-contaminated. So all the catheters come with a safety cap. And can you see the bevel on this needle? It's the slanted sharp spot. We always want to use our catheter with the bevel up so it helps enter the skin easier. And I always like to make sure that my slide works well. Don't pull it back too far, you'll engage the safety device. Make sure you let your patient know you're going to stick them. Don't surprise them with the stick. Okay, Mr. Pena, going to go ahead and get started here. You're going to feel a little poke here. Get that bevel under the skin. And I like to start parallel to the vein of where I'm starting, not on top of it. You will see nurses that do either way, but as a new IV starter, I often think it's great to start just parallel to where you want to stick so you won't go through both the top and bottom walls of the vein and infiltrate your IV. Once you get that bevel under the skin, that's the hard part. Now you can breathe, and now, as long as I don't touch the catheter, I can bring my hand up and kind of help guide where my catheter is going to go. Once you get blood return, you'll see it back in your catheter here. And once I get that initial blood return, I advance my catheter just a squitch more, a couple millimeters, and then we can activate our safety device. So we're pushing the catheter in and pulling back the needle. Did you hear that click? That's our needle disengaging. Now we're going to remove our tourniquet, otherwise we're going to have a bloodbath. Take your 2x2s and put it under your catheter, and that way when you disconnect your tubing, we're not going to have a lot of blood drawing and dropping there. So disconnect this. You always want to hold on to your catheter here. You don't ever want to let go of it. And if you press down with your index finger, your middle finger, press down as you come out, you're going to limit some of the blood that's going to back up. And then very carefully tighten your extension tubing. See how we collected our blood drops there? And now when I pull this out, I have no blood on the patient's skin. Now we're going to flush our catheter. So I'm going to pull back a little bit to ensure that I have a good blood return. And then we're going to advance, and see I'm flushing, and it's real easy to flush. So I leave my syringe attached, but I never let go of my catheter until I secure it really well. So first piece of tape comes down, and I like to tape over the catheter and the hub of my connector so it's taped as one unit. Then we get our Tegaderm and very carefully peel it off so you don't fold it up. And again, you want to place it over your site so you can see the site, but also secure your catheter. And you want to try to make an as occlusive of a dressing as you can. And why do you think that's important? Well, we don't want any bugs or bacteria or dirt getting into here, so we want to keep this IV nice and sterile. Peel this off really carefully so it doesn't come up, and see, now we've got a nice tight seal. And then I take my second piece of tape and I come over that top edge to seal it. So make sure it's nice and secure, and then I always like to give one more little quick flush, because sometimes you can dislodge your catheter during the securing of it. So disconnect that syringe, and now we want to secure our hub. And I like to tape it kind of back like this so it doesn't occlude my site. My tape doesn't go over the site. Never, try to get in the habit of never taping over your site so you can always keep an eye on it. You want to lock this mechanism if it's going to be a saline lock. And then you can get one of your Kuros caps, that are alcohol embedded caps, and put on the top. And this will keep that top nice and clean. And sometimes they can be a little persnickety to get on, but there you go. Now, before we're done, we want to make sure that we date our IV. Now, our Tegaderms always come with a little label like this. I personally don't like to use these because they can flake off and then your IV is non-dated. So I like to come over and on the edge of my Tegaderm, I'll write the date, the size, in case somebody doesn't know their colors, and then my initials. And I'll date it right along the Tegaderm here, so that identifies it very easily. Last thing we want to do is we want to clean up our mess. So, sharps and bloody soaks, 2x2s, and the syringe go into the sharps bin. Everything else we can put in the trash. If you have any yellow labels or charging labels on your IV start kit or your IV catheters, make sure that you put those in the appropriate area. All right, we clean up our mess. We want to finish with performing hand hygiene. And then before you leave the room, always get in the habit of asking your patient if there's anything else that you can do for them. All right, that's it, starting an IV. Hope that helps.